Yes.
No mai, haere mai, and welcome everybody. Thank you for joining us today for today's Heart Help Live session. My name is Jennifer Leonie and I'm a heart health advocate here at the Heart Foundation. So the aim of the Heart Help Live series is to offer New Zealanders living with heart disease or their whānau and friends educational content from a range of specialists and give you the opportunity to connect with experts and gain valuable advice about living with heart disease. So today we're discussing your most common heart questions with our nurses, Jane and Leonie. A little housekeeping before we get started. If you think of any questions throughout the nurses' presentation, feel free to add them in the comment section and I'll bring them up during our Q&A. Also a reminder, we will be moderating your questions as they come through. Please be aware that your comments will be published, so don't include anything that you don't want shared with the group. Any questions we don't get to, we will answer in the comments as soon as we can. So please join us for the next 40 minutes as our Heart Foundation nurses, Jane and Leonie, talk about the common questions they receive. To start, Jane and Leonie will be addressing frequently asked questions about navigating the healthcare system. Now, without further ado, I will hand you over to our lovely nurses.
Oh, thank you, Jen.
Thanks, Jen. Well, we've actually changed the order tonight.
Yes.
So we're actually going to start with tips on how to manage the first few days after leaving hospital.
Absolutely, and it's such an important topic and so many people have a lot of questions when they're first discharged from hospital. And so, Jane, I was hoping you could start us off with answering these questions. Do you have any tips for those first few days in leaving hospital and the discharge after leaving hospital?
Yeah, it's really hard actually. You feel quite vulnerable once you've left the safety and security of hospital. You're there, you've got plenty of doctors and nurses around you to look after you, and although you're desperate to get home, once you get home you can suddenly feel quite anxious, quite vulnerable, quite insecure, and you often think, oh gosh, maybe I've been discharged too early. I often have patients that say to me, oh, I think they discharged me too early. But actually it's really important to get home as soon as you are able, for several reasons. A couple of them are things like it's really important to get home to be able to have adequate sleep. You're often sleep deprived in hospital and you are going to be recovering a lot faster and feeling a lot better getting some good night's sleep in your own bed. In your own home and in your own room. And the other really good reason for going home as soon as you're able is that you are at less risk of getting an infection in hospital. It's called a hospital-acquired infection. The sooner you can get home, the less risk of acquiring an infection. And of course, if you do acquire an infection whilst you're in hospital, that tends to slow down your recovery and can cause complications post-procedure or event. So super important actually to get home. Before leaving hospital though, and in fact you could actually plan this before you even get to hospital if you have warning and you know the time and day that you're going to have a procedure or surgery. So either whilst you're still there or if you have the time beforehand, you can actually start taking a little bit of control and planning your time once you get home from hospital so it's not quite so daunting. So top tips before leaving hospital. As soon as you know when you're going home, you either yourself or get a friend or family member to ring up and make an appointment for you to visit your GP as soon as possible. Ideally in the first week, but certainly, and ideally actually the first couple of days, but certainly in the first week, it's really good and important that the GP sees you as soon as you've left hospital, can give you the once over, can check you out, can discuss medications with you. They'll have your discharge summary by then, so that if anything happens later on and you do have any problems, the GP can use the baseline of when they first saw you to see what has happened or how you've deteriorated or the problems have occurred since then. So number one, super important, get that GP appointment as soon as possible. If which is quite common these days, you ring up and they say, oh no, it's 2 or 3 weeks until we can give you an appointment. Just push back a little bit. Just say you've just had a procedure or an operation in hospital, that the hospital has advised that you see your GP as soon as possible when you get home. Often there will be a couple of appointments set aside for acute or walk-in patients that need to see the doctor urgently, and they might be able to slot you into one of those. So give it your best shot to get there as soon as possible. Also, before you leave hospital, just inquire about cardiac rehab services. Most large hospitals have a cardiac rehab program. If you're from a smaller area, for example, if you had your procedure at Waikato Hospital, but you're going home to Rotorua or Tauranga, your local hospital, so Rotorua or Tauranga Hospital, will have their own cardiac rehab service, which the Waikato Hospital will refer you to. But it's actually quite good to inquire and know a contact number and name of the person to contact if they don't contact you about enrolling into a program. Much easier to get that whilst you're in hospital than once you've left. Another really good tip is to plan some support.
Really important, isn't it?
Yeah, and don't just rely on your family member or your spouse to look after you when you get home. They'll be tired too, and they'll be stressed and anxious as well. So get a little bit of an army around you to support you, whether it's friends, whānau, family members, neighbours that can perhaps pop in and visit you, help you with some meals, maybe drive you places, and be around for that. And then the last thing I'd probably say is make sure that you have an outpatient appointment. So once you go home, an appointment should be made for you to go back to the hospital as an outpatient, so just for an appointment during the day to see a cardiologist or registrar or surgeon, just to give you the sign off and a check. And that usually happens about 4 to 6 weeks after a larger heart surgery or procedure. So if you haven't got that appointment before you leave hospital, just follow that up with your GP.
Oh, those are some really excellent tips, Jane. Thank you very much. It's great to do some forward planning before you even get into hospital, so that when you leave hospital, you've got these things set in place already. So what about the first week? You've been home, you've been discharged. How would you manage that first week or those first few weeks after discharge?
Okay, so first week, you've got your appointment with your GP, which is fantastic. Try and bring a support person along with you to your GP appointment, because you will still be feeling quite tired, might have a bit of general anaesthetic still in your system, might still feel a bit anxious. You may not remember all that your GP has to tell you about your care going forward and your discharge. So really good idea to see if you can get someone to come along with you to that appointment and write down some of the answers or questions that you might have. Plan your day. So no visitors is my personal advice for the first week following a big surgery or heart procedure. Just say, the hospital said that unfortunately I can't have visitors in my first week, love to see you the next week. And then you can just concentrate on settling in, getting to your appointment, having plenty of rest and starting that recovery process. If you've got close family members who desperately want to see you and you want to see them, of course you can do that, but just really try and limit the amount of visitors you have that first week. Don't worry if you are not hungry. It's really common to lose your appetite for the first few days or weeks after a heart event or heart surgery. So eat what you can, eat small amounts, eat heart healthily, so good food, and concentrate on making sure that you keep hydrated. So plenty of fluids.
Really
that's
great
really
tips.
important.
Yeah.
And then also the only other thing I would mention is make sure that you do keep active and mobilised as you can. So short amounts, a couple of times a day, as far as you're able. It might just be a couple of minutes initially, there and back, and slowly work up from there.
Oh, fantastic. Excellent tips, Jane. Thank you very much for that. We also get a lot of questions about returning to work because, a lot of people are worried about the financial impact of recovery after an event. And so do you have any sort of tips or, comments about when you should be returning to work and what you should be watching out for when you return to work?
Yeah, that's really, really important too. Thanks, Leonie. Okay, firstly, make sure you've got clearance from your surgeon or doctor to go back to work. get their sign off, because depending on the type of work you do, if you do quite a labour intensive manual job, there may be some things that you can't do for some time, heavy lifting and moving maybe with things above your head. So they'll want to know what type of work you do, and then they will help you to arrange a plan of when to get back to work to that job, or they'll help you to talk to your employer about perhaps doing an alternative job until you're able to get back to your normal job. So that's super important. If you're having any trouble negotiating or communicating with your employer, you can ask for a letter from your cardiologist or your surgeon or your GP, just to explain as much as you would like them to know the procedure you've had and the things that you aren't able to do, or they recommend that you recover slowly through. Talk to your manager or organise a staggered return. So maybe you could work initially every second day, so Monday, Wednesdays and Fridays, maybe just half days, so you've got a rest day in between.
Oh, some excellent tips there. Really important, because I think the thing is, if you return to work too soon after a heart event, then there is a risk that you could have a relapse and it will take longer for you to recover. And so by having a slow, steady return to work plan in place, it means that you can actually get back to work and earning an income a lot sooner. Chest discomfort, really important question, because people are always going to be concerned about chest pain, and it is, I understand, quite common to have chest pain after a event or a investigation or a hospitalisation. So what chest pain is normal, Jane, and what should people be worried about? When should they be accessing care if they are concerned about chest pain?
Yeah, that's a really tricky and quite complicated question, actually.
It really is. It's one we get quite often, actually, isn't it, on the phone line?
Yeah, I think I'll keep it really simple. Basically, everyone's individual, so it does depend on your procedure. Secondly, it's really common to have chest discomfort after a procedure that's not necessarily, and very rarely actually, angina or anything life-threatening. It's generally as your heart settles and recovers, or your artery settles and recovers after it's been stretched with a stent, you get some chest discomfort there. As the swelling reduces and your heart heals, that tends to settle down and are usually days or sometimes a week. So if you've had stents, actually, almost half of people who have had a stent do experience some chest discomfort due to that stretching of the artery. And if you've had heart surgery, often where the healthy blood vessels been grafted or bypassed on, that can be a sore and swollen area too. So if you're concerned, see your GP. If you're really concerned, and by that I mean you have a feeling of constant, moderate or severe chest pain or pressure.
It's not relieved with rest.
It's not relieved with rest,
absolutely.
And you have or difficulty breathing, then just dial 111 and call an ambulance. But do be reassured that most often it is just your heart settling down and recovering.
And I think, sort of to finish off this sort of post-discharge topic of conversation, it's really important to acknowledge the mental health and the mental recovery that does come with a event like a cardiac event. And so do you have any tips about the mental recovery after a cardiac event?
Yeah, so mental health is just as important as physical health, and they go hand in hand. So it's really common to have feelings of depression or anxiety after a heart event. Heart's really important, so it's normal. If it goes on for more than 7 days, you're feeling really down and depressed or very anxious, and you've had no relief from that for 7 days or more, I would go and see your GP or seek advice. Mentalhealth.org.nz has a great website. They also have a great number, a 1737 helpline. There's anxiety.org.nz. So look online, seek support from whānau, family, friends, talk to your GP. Know it's normal, don't rush it, don't rush your recovery, be gentle with yourself. And seek help if you need it. Everyone's different, and these things take time.
And recovery is a process. You can't expect too much too soon. You have to allow that time to allow recovery to occur when you're experiencing a significant event. So
I'm going to move straight on, because I'm just keeping an eye on the time. But I would like to ask Leonie a couple of questions now about our next topic, which is how to access and navigate our public healthcare system. And this is, hopefully you'll get some really good key pointers here to help you where it can be quite frustrating. So Leonie, very briefly, could you tell me what an NHI number is and why it's important?
Yeah, absolutely. I mean, this is a bit more of a technical discussion, but we will keep it as simple as possible and as brief as possible for you guys. But there are some key things I think it's really important to remember. Number one, your NHI number stands for your National Health Index number, and every person in New Zealand has one of these. If you were born in New Zealand, it was given to you at birth. If you're an immigrant or you're a visitor to New Zealand, then this particular number is given to you when you first access medical services when you arrive in New Zealand. So if you do need to access health for any particular reason, it's given to you. It is a 3-letter followed by 4-number number. So ABC, for example, it would be ABC 1, 2, 3, 4. And it uniquely identifies you for any healthcare services that you receive anywhere in New Zealand, whether it be medical or dental. And so we definitely recommend that you know this number and have it on hand. If you don't know what it is, then contact your GP and they'll be able to give it to you. One thing to note, medical records within New Zealand are at the moment kept in isolation, and so if you live in Dunedin and access healthcare in Dunedin, for example, but then move up to Auckland, your Auckland providers would need to request those medical records so that they can see them and access them. There is work in progress with our Health New Zealand or Te Whatu Ora to make that more universally accessible.
Perfect. So, what if I've been referred to the hospital for a test, a cardiac test or investigation, and I want to know a bit more information about that referral? What would I do?
Yeah, so if you've been referred through to the hospital system, which is also known as our secondary services, so if I use those interchangeably, secondary and hospital mean the same thing, there are a couple of ways to know how your referral is progressing. And the first one would be to go back to the referrer. The referrer is someone who is usually your GP, but can also be allied health professionals like a physio or an OT or a nurse as well. And so you could ask the referrer what stage your referral is up to, and they can give you a guideline as to how long you're expected to wait until you're seen by secondary. Or you can contact the outpatient scheduler. Because we're talking all things heart and cardiology, that would be the cardiology scheduler through the secondary services, and that would be specific to your regional hospital. Give them a phone call and just say, my referral's been sent through. Can you give me an update as to how long I'm expected to wait until I can be seen by the specialist? And they will give you a time frame.
So I've heard there's like priorities on the wait list. What does that mean and how are they prioritised?
So once a referral is sent by the provider, the GP or the nurse or whoever it is that sent the referral, it's accepted by the secondary services. It is triaged by a specialist, normally a cardiologist, and then it is prioritised. The priorities that are given are a 1 to 4 number, 1 being a person will be seen as soon as an appointment becomes available, whereas 4 is you can wait for a period of time before you might be seen, and so 4 is the lower priority. Then of course some referrals are declined. So if your referral is declined, please don't worry. It is fairly normal, especially because cardiology services in New Zealand are very overrun at the moment. Just heart disease is a leading killer both in New Zealand and the world. And so the wait times in general are going to be quite extensive no matter what. But if your referral is declined, it also means that the specialist knows that your GP can manage your condition out in the community, and so you don't actually necessarily need to be seen by a specialist. So once the referral has been given a priority, you're then given an expected wait time. You'll normally be notified by either post or email what your priority is. If it's a 1, it could be a 4 to 6 week wait, whereas if it's a priority 4, it could be upwards of 8 months or 6 to 8 months type wait. It's really difficult to say, and it does depend a little bit on the regional hospital that you're associated with, the sheer number of people who live in your area. It could be the resources that are available, so how many specialists are available. It could be whether or not they've got a cath lab available. So there are a number of factors that come into play regarding that. One thing I will say though is if you are waiting for a long period of time, do follow up with a phone call just to find out what sort of time frame you're expected to wait, and also to ask if you can be put on a cancellation or a short-term wait list, because that means you can potentially be seen slightly earlier.
So if I was to ring up and give my NHI to the cardiology outpatient scheduler and get an idea of timing, often they can't be specific, of where I am on the wait list, would it be worthwhile me saying, oh look, I live 10 minutes down the road from the hospital, I can come at really short notice any day of the week if you have a cancellation, which I understand is happening occasionally or quite a bit because of COVID, so people aren't able to go to the appointment. Is that worthwhile doing? And perhaps if possible, the scheduler can put me on a short notice or cancellation wait list and I might get to be seen earlier.
Absolutely. I mean, there's no guarantees, obviously, in life, but it's something that you can definitely ask for, and it could potentially help progress your referral or your wait to be a slightly shorter period of time. I mean, the other thing to consider is if your health condition does deteriorate, or if you start to find that quality of life is getting worse rather than better, if your symptoms are becoming a lot harder to manage, the other thing that you could do is be in constant contact with the referral or your GP, and they can update your referral with the fact that your condition has changed. And with that update on the referral, the specialist might consider changing your priority to a slightly higher or sooner to be seen priority. So, you know, I think it's good to keep that in mind as well, and do keep in regular contact with your GP.
You sort of answered my next question.
Oh, sorry, I jumped ahead, didn't I?
No, it was great, which was really, what if I'm on the wait list and just waiting for my procedure or my test, and my condition gets worse?
Yeah. So we addressed that a little bit just before. So if your condition gets worse, definitely see your GP. If your referral was declined in the first place and you're back in the care of your GP, but your condition does worsen and your GP feels like a specialist review might be necessary, then they can re-refer you. So if your referral has been declined initially and your condition worsens, definitely go back to see your GP, because they can put another referral through to cardiology services.
Oh, that's fantastic. Is there anything else, any other tips you've got about navigating the healthcare system or the referral process?
So one thing to note, and I think it's really important to remember this, once a referral is sent off, it can take 2 to 4 weeks before it's actually seen, triaged and assessed by the specialist. And so if you haven't heard anything over a period of weeks under the public healthcare system, please don't worry or panic. Keep in contact with your GP. They can let you know what sort of wait time you might be experiencing. After 4 weeks, you can contact the outpatient scheduler yourself, and then they can give you a guide. Very occasionally, as with life, referrals do get lost in the system, and it can be resent by the referrer. So I think the key thing is knowing that it's a 2 to 4 week wait before you expect to hear even a little bit back from the hospital.
So if I was waiting for 4 weeks and I'd heard nothing, would it be worthwhile me inquiring with my GP or bringing up the cardiology scheduler and just say, have you received my referral?
Yeah, absolutely. Have your NHI number on hand, that National Health Index number. It's really important. So a few other things that is important to sort of know about the referral process is if your condition worsens, make sure you do get help. We've talked about this very briefly, but I do want to touch base on if your condition worsens significantly and over a short period of time, don't wait to get help, is what we want to get the message across. You know, if you've got an appointment and you know it's coming in, say, 3 or 4 weeks' time, you're feeling worse, but it's really quite significant, don't wait for that appointment. Go and see your GP, go to an accident and medical centre, or if it's life-threatening, make sure you call 111. And I think we briefly touched on the life-threatening message with the chest pain, the heaviness, the shortness of breath, things that aren't resolved with rest. You need to be contacting our emergency services for immediate help regarding that.
Yeah, especially if they're sudden and they're severe, then it's important to just dial 111.
Yeah, absolutely.
You can find more information about heart attack warning signs on the Heart Foundation website, so do go ahead and have a look at those. If you're worried about following up yourself, can you ask someone
family,
to help you?
Absolutely.
Yeah.
Family, fun, our friends, you know, anyone who can be a support to you. It's really important to have those people in your life. You know, if you're an older adult, having a younger adult child go along to support you, a friend, you know, anyone who can just walk the journey with you, help you, support you through these appointments, or phone on your behalf. But one thing to remember, if someone does phone on your behalf, you need to be there so that you can give permission for your medical records to be shared.
Thanks, Leonie.
Yeah, excellent.
Awesome. Thank you, Jane and Leonie. So we'll go ahead and take some time for questions now. Just a reminder, please be sure to type your questions in the comment section. So we've had a number of questions emailed in to us over the last few weeks. First up, a question from Bronwyn, who is about to have a mechanical aortic valve replacement and will be taking warfarin. She heard that self-testing warfarin is becoming more available, so she wants to know how accessible this is. She's heard there's issues accessing the test kits. What sort of costs would be reasonable? And is there anywhere that might provide subsidy or support?
Yeah, that's a great question, Bronwyn. Thank you for asking. So just to let everybody know, INR monitoring is a test that is done when you're on a medication like warfarin. Warfarin is a blood thinning medication, and you need to keep a really careful eye on what your blood is doing, because if you take too much warfarin, it can thin your blood too much, that it can cause a bleeding risk. Whereas if you're not taking enough warfarin, it means that you're at the risk of clotting, which can cause heart attacks and strokes, of course. And so INR monitoring is usually a blood test that is done, often through lab tests. The results are sent through to your GP, and the GP can then give advice over what daily dosage of warfarin medication you should be taking. Now, we have what's called point of care testing in New Zealand. Point of care testing is a finger prick test that can monitor your warfarin levels. It's a little bit more friendly to people. It doesn't hurt quite as much, although you can get a little bit of bruising at your fingertip. And it means you get instant results. And so a lot of pharmacies in New Zealand already do point of care testing. Regarding your query though, Bronwyn, whether or not you can do it yourself, that is something that you would need to discuss with your GP, because it is really important to maintain a normal threshold for your INR level, and if it goes outside of that range, it can be detrimental to your health. And so while people can do self-monitoring, it does need to be done in close connection with your family practitioner. One thing to note is there are no fundraising, there are no subsidies available for individual testing, and so as a basic base range, a kit itself is about $1,000 for the little machine. And then you also need to purchase lancets and testing strips, and those are an ongoing cost, and that would depend on the frequency of how often you're having to monitor yourself. And so those costs are around $220 that you would need to account for as well. So really important that you do discuss with your GP whether or not this is something that is going to be applicable for you at home.
Okay, so the next question has come in from Steve. So Steve has asked, why is it important to keep taking your meds if they're not working?
Oh,
Jane, do you want to
Steve,
take this
I
one?
wonder why they're not working. I'm wondering whether you mean that you're not feeling any different, or whether they are working but you can't tell. So for things like if it was you're taking medication for high blood pressure, you don't know really. Most people don't notice and can't feel that they have high blood pressure, so it may not feel like it's working for you. But it's important just to keep the general message is if you're feeling they're not working, go back and see your GP or your cardiologist and discuss your medication. Ask for a medication review. There's lots of different types of medications that you can be prescribed within the class of medication that you need, whether it's antihypertensive, high blood pressure medications, cholesterol medications, anti-arrhythmia medications. So your GP or your cardiologist can tweak them. They can lower the dose, they can increase the dose, they can change the medication and try it. So it's actually a really good idea if you feel it's not feeling right or it's not working, to go back and ask for that medical review. There's lots of choice out there, and sometimes you do have to experiment a bit to get something that suits
But
you.
I also want to add on to that very quickly, don't stop taking your medication. It's so important to keep taking it no matter what, because even if you don't feel like it's working, it's just something that we wouldn't recommend you stop without the support or advice of your GP or medical doctor.
Quite right.
Yeah.
Good point.
Yeah.
Great. Okay, so question from Regasami. I apologise if I've mispronounced your name. Can you take aspirin, beta blockers, statins with calcium, and metformin all at one time in the evening?
Did you want to take this one?
Well,
Jane?
actually,
Yeah, you
you
can.
could.
Yeah.
You could.
Yeah.
It does. Again, you need to talk to your GP because we don't
Yeah.
know you, and we don't know your underlying conditions and any other conditions you might have, as well as your heart condition. Obviously, with metformin, I'm guessing that you have diabetes,
And also with metformin, I would expect you're probably on more than once a day dosing as well. You're probably on either twice or even 3 times a day dosing potentially with that one as well.
Yes. So commonly you're metformin morning and evening, but yeah, you can possibly take all those at once. But I would just check with your GP.
They wouldn't interact with each other, just to reassure you in that regard.
I think there's some more questions coming up. I know there's one that's really commonly asked, which is why do I feel really tired in the evenings, and I'm fine when I first wake up in the morning, and I can really relate to that. I don't think it's necessarily just cardiac. We often feel a lot more tired in the evenings. Obviously we've had a busy day, but there can be actually real reasons for that, and it could be to do with your medications when they're taken in dosage. It could be to your level of fitness, so really important as best you're able to keep as fit as you possibly can. And it could be at your stage of recovery, and it could be to do with your heart condition. So no, don't accept that status quo, but see if you can find different ways to improve that, so you have more energy. Maybe you're doing a little bit too much in the day and you need to just take a break.
Okay, so Caroline has asked, after 5 years, why am I still short of breath?
Oh, that's a slightly difficult one, Caroline, because we need a little bit more information to really be able to answer that adequately for you. Shortness of breath can be from a number of reasons. It could be respiratory based, or it could be cardiac based if you've got something like heart failure. It could be that the medication that you're on is not working adequately. It could be what else? It could be fluid buildup in the lungs. So it is quite a difficult one to answer with the basic information that you've provided. But if you would like to put more information through to us, what we could do, Caroline, is respond a bit more adequately to answer that query for you on our chat after the session is finished. I'm sorry, I don't feel like I've done that question justice, to be honest.
No, I totally understand too. Good question though,
it's
Caroline.
an excellent question.
And there's often lifestyle things that you can do too, just anyway, which is keep yourself as fit as possible, low salt diet, heart healthy diet, plenty of sleep, and perhaps some relaxation and breathing exercises.
Yeah, and exercise is still important even if you are experiencing shortness of breath, because that is really important for heart health as well. So, yeah.
Okay, so Letitia asks, can Nanodol make you have mood swings? My 10-year-old has been on it for 3 months now, and she seems to be a bit more grumpy.
Well, that's a tricky one too. I think that it would depend on why your is it your niece that's the daughter that's taking it, what she's on it for. It might be a condition that's causing the grumpiness rather than the medication. So again, I would check with your GP.
Yeah, I mean, some medications do have side effects. So Health Navigator is a really good website to talk about potential side effects as a consumer-facing tool. So you could have a look on that website just to see whether or not that medication has mood swings or grumpiness as part of the expected side effects. If not, again, like Jane has suggested, talking to the GP about whether or not it's the right medication for her condition, and also with the side effects that she's experiencing.
Okay, so Kerry wants to know about intermittent fasting. So I've heard it's good for the health and it might help me lose some weight. Is it okay for my heart?
Good. Jane, I'm going to let you tackle this one.
Question, Kerry. Well, we know intermittent fasting is quite the thing at the moment, isn't it? It's sort of the latest diet. Well, for some people a fad, but for some people it really does make a significant difference.
I've got to confess, I've done it off and on in the past myself.
So from the Heart Foundation's point of view, and from a heart perspective, basically intermittent fasting, for those of you who are not familiar with it, involves not eating any food during planned times, but it can vary a lot. There's lots of different types of intermittent fasting. So it can be mild, you can just not eat after dinner, and then have a breakfast in the morning, to the extreme where you are fasting a couple of days a week. Yes, there is definitely there's not a lot of evidence to say that it helps to reduce weight long term. And as far as for somebody with a heart condition, I would definitely be checking with your GP or cardiologist, because it may interact with other issues that or problems or medical conditions or medications that you're taking. So you might want to consider your individual energy levels, other symptoms, level of activity, timing of your medications that might interfere with that, any other health conditions that you've got, and certainly if you are a diabetic, insulin dependent or type 2 diabetic, that would not be an appropriate diet to have. But whatever your dietary approach, I think it's really just important to follow the principles of a heart healthy diet. There's lots of information on our homepage of the Heart Foundation under the Wellbeing tab that talks more about a heart healthy diet.
So a question from Kaya. My dad had a heart attack in his 50s. Am I at risk? I'm a 40-year-old lady.
48-year-old lady. So someone who is an immediate family member who's had a heart event, so by immediate family member we're talking parents or siblings, who's had a heart event, and we've got a fairly arbitrary age of 50 or under, does put you at higher risk. Someone who's had an event in their 50s is still a little bit borderline, and so I would definitely be making sure that you're in regular contact and having what's called a cardiovascular disease risk assessment done through your general practitioner. These are done from it's a differing age depending on your ethnicity and your previous medical conditions, but generally a female who doesn't have any pre-existing conditions or anything like that would start having them from age 55. Given your dad had a heart event in his 50s, I would suggest maybe starting those slightly earlier, because it could potentially put you at slightly higher risk. And also females, given the fact that you're a female, they're less diagnosed, but no more, they are still as prevalent in females. Heart disease is as prevalent in females as in males, but it is less commonly diagnosed. And so I think it's really important to be aware of your risks and definitely go through and have what's called a CVD-RA through your general practice. In fact, everybody, no matter who you are, should be talking to your GP about cardiovascular disease risk assessment, because that means you can get early interventions in place to prevent you from having a cardiac condition longer term. Yeah.
Awesome. Okay, so Steve asks, what is a heart palpitation? Is there a breathing exercise that will help with this?
Oh, well, good question, Steve. Heart palpitation is really any type of heart rhythm problem or temporary, what we call arrhythmia, where the heart is not beating in its regular, what we call sinus rhythm or normal rhythm. Heart palpitation is really common. So I think everybody watching and everyone in this room would have occasional heart palpitations when something exciting is happening or something scary is happening, or feeling anxious.
Yeah.
Breathing exercises, yes, there's some great breathing exercise and relaxation exercises also on our website that may help for you, but it's very, very individual. So again, I think it's really important to find out what works for you. Talk to your GP. If these palpitations are becoming more frequent and happening more often, I would advise you to go to your GP and ask for an ECG in the first instance. If it doesn't capture any problems with your heart, but they're still happening and they're happening more frequently and more severely, then you might be referred to a cardiologist for a test such as a Holter monitor test, where they can put some dots on your chest and they can record your heart rhythm constantly for 48 to 72 hours.
Okay, so Shelley asks, can you take magnesium supplements with statins? She gets a lot of cramps and finds sleeping difficult at times.
Magnesium is a really great medication for cramps and to help with sleep. To be honest, Jane, I don't know if you know this off the top of your head, but I would probably just want to look up the interactions before confirming whether or not you can take them with statins. Do you happen to know off the top of your head?
I think it's fine,
I
Shelley,
do think it's fine, but yeah.
I agree with you, Leonie. Just check with your pharmacist, because they're the people who are dispensing your medication. They're the experts in medical interactions with different medications, and they know what you're on. So I would, as far as I know, it's fine, but I would just check with your pharmacist first.
Okay. Steve wants to know, is massage good for you when you have heart failure?
Oh, I think massage is good for
I think
you.
it's wonderful.
Anytime,
I think it's a brilliant thing to do.
And I'm not sure whether you're talking about massage to help move or remove fluid.
Yeah.
From your legs or from your around your waist area or lower back. But a massage is just a great form of relaxation anyway. So it certainly is not detrimental to heart failure, and I certainly don't think would do any harm, and it may actually be of some benefit. But probably don't do it as an alternative to your heart failure medication, and certainly not as an alternative to your, if you're on it, furosemide or diuretic. That's the water tablets that help to get rid of excess fluid. If you need to take those, and that again will be guided by your GP. I think we've got a couple more questions coming up. Hannah's just getting those up for us now.
We've got a great team who are working behind the scenes to make sure your questions are actually coming through to us. So,
okay, here we go. So Tony had an ICD inserted last month. He didn't like surgery, but I'm relieved. I didn't like surgery, he said, but I'm relieved I've got this now. Can I go back to the gym?
Oh, yes, you'll need clearance, Tony.
Yes. Don't rush back.
From your cardiologist, probably, rather than your GP, or your GP might ring and ask some advice from your cardiologist. Did it say, sorry Steve, did it say how long ago?
Tony.
It
was only a month ago, and so I think it's important to note with any sort of ICD or pacemaker that's inserted, there does need to be a bedding in type process where scar tissue forms over the wires that are put in place. And so generally you're recommended not to lift the arm on the side that it's put in, which is frequently your left side, for a period of about 6 months, I think it is, 6 months, to allow that scarring to occur. And so I probably would definitely not recommend that you're returning to the gym after a month. I would be giving it a lot more time, and also talking to your GP before you do return.
Yeah, or you could negotiate.
Yeah.
So you could leave your upper body, your chest.
That's true.
And
Yeah,
you could do
absolutely.
some walking, and you could do some cycling on a stationary cycle, and you could do some treadmill work rather than using the upper body at the gym.
Okay, so a question from Jordan. I did a blood pressure test at the chemist and it was high. Not sure what I should do.
I would say with blood pressure, one thing that I generally say to people is, one reading in isolation doesn't mean that you're going to have a diagnosis of high blood pressure. It is still really important to follow it up though, and there are a number of factors that could mean that your blood pressure was high in isolation, but alternatively it could be high and needs interventional treatment. So I would definitely follow up with a appointment with either your practice nurse or your GP. Your practice nurse would be absolutely fine to recheck your blood pressure. What we would typically say in the medical field is 3 elevated blood pressures over a period of sort of 2 to 4 weeks. If they remain elevated over all 3 recordings, then there is a potential for a diagnosis of hypertension, which is high blood pressure. And so it's definitely worth following up and checking. If it comes down with your next visit, then that's reassuring to know that it might have been high in isolation, but it's still worth considering some lifestyle changes to make sure that it doesn't go high over a long period of time. Yeah.
Okay, so Bruce asks, after a bypass, how long before energy level comes back? I'm on week 3, a struggle to walk 4 lampposts.
Yeah, Bruce, yeah.
That's hard.
So as I sort of touched on earlier, it is really individual, so it takes the time it takes, and you will get there. It is still early days with 3 weeks since your a major operation. Good on you.
It's a really big operation that you've had as well with bypass surgery. So
good on you for getting out there and doing your 4 lampposts each day. Persist, and if it's getting too much, just do 2 lampposts, but do it twice a day. So it's important that it's more important that you're doing it frequently and often for shorter periods of time or shorter distance than trying to do one big long one. So hang in there, stick with your 2 to 3 lampposts. If you're really tired, cut it down. As you feel better, increase it again.
And also, I just want to add on to that as well, Jane. I mean, that's really good advice, but I'd also like to say it's important to track those little steps, because it's really easy to go back and think, I haven't made any improvement whatsoever. But actually, as the weeks go by and as the days go by, those little steps actually count towards bigger rewards. And so, like Jane says, 3 weeks is really quite early. We wouldn't be expecting too much at this particular stage. Bypass surgery can take anywhere from 3 to 6 months to recover from in full, and some people even up to a year, depending on their individual recovery rate. So just take it step by step, literally.
Okay, so we've got time for one more question. Lisa asks, I'm always getting breathless, so how do I exercise?
Oh, Lisa, that's a really good question too, and I'm not quite sure of your personal heart experience or condition, so a little bit difficult to answer. I guess again it would be just perhaps check in with your GP. We don't know what your condition is here, to check whether you're on the right medication and the right dose, because if it's to do with your heart not being able to pump effectively, you might need to be prescribed some medication like furosemide to reduce some of that fluid and help your lungs to be able to manage a bit better. It could be to do with a heart rhythm problem, or it might have something to do with your fitness level. Things you can do to help reduce those feelings of feeling really breathlessness are to really focus on your lifestyle, how healthy lifestyle. You may already be doing this, but there are things like regular exercise, a low salt diet, a heart healthy diet, managing your weight so that you are the right weight for your height, getting plenty of sleep, which also if you are sleep deprived you tend to put on weight, and do some relaxation and some breathing techniques that again you can search up online, either Heart Foundation website or through your GP.
Okay, thanks Jane and Leonie. It looks like we've covered all our questions. If we didn't quite get to yours, we'll answer them in the comments. Jane and Leonie, is there anything else you wanted to cover before we wrap up?
We've covered a lot today, so hopefully everybody's got a little bit of tidbit of information that they can take away with them as they go about their day. But just remember, we do have, lots of places where you can access information, or giving us a call as well, maybe.
And I would just say,
Yeah.
don't compare yourself.
No,
Everyone's different.
Absolutely.
It's your body, your heart, and you do you in your own time. And be gentle on yourself. Make a plan. Seek some help and some support.
And really important to stay connected with your GP, because they are your primary provider. So if there's any one key piece of advice I'd give is, try and establish a really good rapport with your general practitioner who will be managing you long term.
Awesome. Thank you everyone for joining us. We appreciate you being here. It would be amazing if you could give us some feedback on this session through a short survey we've posted in the comments. Please join us again next time on the 15th of March, where our medical director, Dr. Jerry Devlin, will be talking about long COVID and the heart. So thanks again for joining us today, and we'll see you next time.
Thanks,
Goodbye.
everyone.
Bye everyone. Thank you.